Today, we're gonna cover the more complex epithelia. So last time it was simple epithelium, and today we're gonna cover stratified squamous keratinized, stratified squamous non-keratinized, transitional epithelium, and glandular epithelium. And we're gonna start with our slides. So the goal is, this is supposed to be a high-yield teaching set. We're gonna compare skin and esophagus to help us compare the two stratified squamous patterns. Then urinary bladder is going to help us understand transitional epithelium, and salivary, or whichever gland I find, actually esophagus, I'll have to find along these slides as well. So I'm going to go a little higher magnification, but not too high in a second. As I said, the goal is not to memorize, but to look at the slide and ask yourself, what kind of surface is it? What job does it need to do? Is it, so last time we talked about the simple epithelium. What job does it need to do? If we are breathing, it has to let stuff in, the air, the molecules, and be like not literally permeable, but easy to do exchange. And here, we have something else. But if you ask yourself what kind of surface this is, and here's our surface, this is the top, and what job does it need to do, the question makes specialized epithelium a lot easier. So I'm going to tell you what that is. Let's start with the one most people recognize, and I think you recognize. This is skin, and this is stratified squamous keratinized epithelium. So we're going to look at low magnification. What do we see? So we have like this dark pink at the top, we have this middle pink, and this is more whitish at the bottom. So the top is the epithelium, and then we have connective tissue, and we have adipose tissue. Where my mouse is, adipose tissue is also a type of connective tissue. This is going to be covered in the next live stream, but let's just look at the overall pattern, right? What do you see? We saw the surface. This is the epithelial layer, and underneath, we already named, this is the connective tissue. And this is already telling us something, that this is not simple epithelium, right? Here we have multiple layers. And let's zoom in. Why do we need multiple layers? We need multiple layers because we need some protection, right? This is always the case. If there is more than one layer, it needs to protect from something. So skin is going to be protecting us from everything outside, right? Every abrasion, everything. And in different places on our body, it's going to look different, right? It's going to be thinner in some places and thicker in some places. Where do you think it's going to be thinner, and where do you think it's going to be thicker? So like, is it going to be thinner on the top of your hand, or is it going to be thicker on the palm? Top or palm? It's going to be thicker on the palm. It's going to be also super thick on your feet, on the bottom of your feet, because this is, and especially if you walk a lot without shoes, like on vacation or whenever, right? This part is going to be super thick.